I'm Dr. Sara, and I want to speak to you man to man for a moment. Losing strength or size is not a sign of weakness, and it's not something that happens overnight. Your body doesn't fail, it gets blocked. When blood flow slows and balance is lost, performance drops and confidence follows. But your body doesn't forget how to be strong. When you support it the right way, it responds. This is not about shortcuts or shame. This is about understanding your body, restoring balance, and taking back the strength you were always meant to have. Most men are never taught that the internal chemistry of their body plays a direct role in their sexual health, strength, and physical performance. In clinical practice, one of the most overlooked factors affecting male vitality is chronic acidity. Modern lifestyles filled with stress, poor sleep, processed foods, excess sugar, smoking, and long working hours push the body into an acidic state. When this happens, the blood becomes thicker, oxygen delivery slows down, and circulation begins to suffer. Blood vessels lose their ability to relax properly, and tissues that depend on strong blood flow do not receive the nourishment they need to function at their best. Over time, this silent imbalance begins to show up as reduced firmness, slower response, and a noticeable decline in overall confidence. From a urological perspective, acidity directly interferes with the way blood vessels behave. Healthy male performance depends on the ability of arteries to expand and allow rapid blood inflow. In an acidic environment, the body shifts into a defensive mode, tightening vessels and reducing nitric oxide availability. Nitric oxide is essential for smooth muscle relaxation and proper vascular expansion, and when its production is blocked, circulation becomes restricted. This restriction does not happen overnight, which is why many men are confused when they feel gradual changes without any clear warning signs. What they are experiencing is not a sudden loss of ability, but a long-term chemical imbalance that has been building quietly inside the body. Another critical effect of excess acidity is its impact on oxygen levels at the cellular level. When tissues receive less oxygen, cellular energy production drops. This directly affects tissue elasticity, responsiveness, and endurance. In the context of male health, poor oxygenation can make tissues less flexible and less capable of expanding fully during arousal. Over time, this can influence perceived size, firmness, and overall performance. Many men mistakenly blame hormones alone, without realizing that hormones cannot work efficiently in a toxic acidic environment. The body must first be balanced before it can respond optimally to any natural signal. Bicarbonate plays an important role because it acts as a natural buffering agent in the body. Its function is to neutralize excess acid and help restore a healthier internal balance. When acidity is reduced, blood becomes smoother, circulation improves, and blood vessels regain their natural ability to relax. This creates an environment where oxygen delivery improves and tissues can function as they were designed to. The change is not artificial, it is a return to normal physiological conditions. When the internal terrain is corrected, the body no longer has to fight itself, and natural performance begins to improve. What makes this concept so powerful is that it shifts the focus away from external fixes and back to internal health. Instead of forcing results, the body is supported in removing what is blocking its potential. As circulation improves and cellular stress decreases, many men notice better fullness, stronger response, and renewed confidence. These changes are not driven by stimulation or dependency, but by restoring balance at the most fundamental level of human physiology. Blood flow is the foundation of male strength, responsiveness, and visible performance, yet most men underestimate how easily this system becomes compromised. In urological practice, one of the most consistent patterns observed is that reduced circulation almost always precedes complaints related to firmness, endurance, and perceived size. When blood cannot enter tissue efficiently or remain there long enough, tissues fail to expand to their full capacity. This limitation is rarely caused by a single issue. Instead, it develops gradually as metabolic waste, inflammation, and acid buildup interfere with vascular function. The result is sluggish blood movement and restricted expansion, even in men who appear otherwise healthy. Bicarbonate supports blood flow by addressing the chemical environment that determines how blood vessels behave. Excess acidity forces the body into a protective state, causing vessels to constrict and smooth muscles to remain tense. In this condition, nitric oxide, the molecule responsible for signaling blood vessels to relax, becomes less available. Without sufficient nitric oxide activity, the arteries cannot widen effectively, limiting the volume of blood that reaches sensitive tissues. By buffering excess acid, bicarbonate helps normalize pH levels, allowing nitric oxide signaling to function more efficiently and restoring the natural relaxation response of the vascular system. As circulation improves, the effect on tissue expansion becomes more noticeable. Healthy tissue is designed to fill, stretch, and maintain pressure when blood supply is strong and sustained. When blood arrives easily and remains longer, tissues experience improved oxygen delivery and nutrient exchange. This enhanced environment supports cellular hydration and elasticity, two critical factors in tissue responsiveness. Over time, better hydration allows tissues to appear fuller and more responsive during arousal, not because of artificial enlargement, but because the tissue is finally operating under optimal conditions. Another overlooked benefit of improved blood flow is its impact on waste removal and inflammation control. Poor circulation allows metabolic byproducts to accumulate, which further irritates blood vessels and reduces flexibility. By enhancing blood movement, bicarbonate indirectly supports the body's ability to flush out waste and reduce low-grade inflammation. This creates a positive cycle. Improved circulation leads to healthier vessels, which in turn further improves blood flow. The tissue becomes more resilient, and the vascular system becomes more adaptable rather than rigid and reactive. What makes this process especially relevant for men is that it works in harmony with the body rather than overriding it. Instead of forcing a temporary effect, improving the chemical balance allows the body to use its own mechanisms to restore strength and responsiveness. When blood flow is no longer restricted by acidity and tension, the natural expansion process becomes more efficient. The changes may appear subtle at first, but with consistent internal balance, many men experience noticeable improvements in fullness, sensitivity, and overall performance, driven by physiology rather than external stimulation or dependency. As men move past the age of 40, subtle physiological shifts begin to compound in ways that are often underestimated. Metabolism slows, recovery takes longer, sleep quality changes, and stress hormones tend to remain elevated for longer periods of time. Alongside these changes, the body's ability to regulate acid-base balance becomes less efficient. Years of processed foods, caffeine, medications, reduced physical activity, and chronic stress gradually increase internal acidity. This does not usually cause immediate symptoms, which is why many men feel blindsided when performance, firmness, or responsiveness starts to decline despite no obvious illness or injury. From a urological and vascular standpoint, aging blood vessels are especially sensitive to acidic stress. With time, vessel walls naturally lose some elasticity, and when acidity is added to the equation, this stiffness becomes more pronounced. Blood flow that was once fast and effortless now meets resistance. This is why men over 40 often notice changes that younger men do not, even when following the same habits. The issue is not simply age, but the accumulation of chemical and metabolic stress that narrows the margin for error within the body. Bicarbonate becomes relevant in this stage of life because it supports systems that are under increasing pressure. By helping buffer excess acid, it reduces one of the key stressors that accelerates vascular aging. When acidity is lowered, smooth muscle cells and blood vessels are better able to relax, and circulation becomes more efficient. For older men, even modest improvements in blood flow can translate into noticeable changes because they are starting from a more constrained baseline. This is why men over 40 often report more dramatic differences compared to younger individuals whose systems are still more resilient. Another reason changes feel more significant at this age is tissue responsiveness. With ongoing acidity and inflammation, tissues gradually lose hydration and flexibility. Cells become less efficient at holding water and oxygen, which affects expansion and endurance. When acid load is reduced and circulation improves, cellular hydration begins to normalize. Tissues respond more fully to blood inflow, and the sensation of fullness and strength becomes more apparent. This shift can feel surprising, not because something new is being added, but because a long-standing restriction is being lifted. Hormonal signaling also becomes more sensitive to internal balance as men age. Testosterone, nitric oxide, and other key messengers rely on a healthy cellular environment to exert their effects. In an acidic, inflamed system, these signals are weakened. When balance is restored, hormones can act more efficiently without necessarily increasing in quantity. This is an important distinction because it explains why some men experience improvements without taking hormone-altering substances. The body is simply using what it already produces more effectively. The cumulative effect of these changes explains why men over 40 often describe the experience as a turning point rather than a minor adjustment. Improved circulation, reduced inflammation, better tissue hydration, and more efficient signaling work together to restore functions that felt like they were slowly fading. The body becomes less reactive and more responsive, allowing natural mechanisms to operate with fewer obstacles, creating changes that feel both physical and psychological in nature. When men talk about size, strength, and confidence, the conversation often stays on the surface, focusing on quick fixes, external stimulants, or exaggerated promises. In reality, true male vitality is built from the inside out, and the most important factor behind visible performance is vascular health. Blood is the carrier of oxygen, nutrients, and signals that allow tissues to respond fully. If blood flow is compromised, no amount of stimulation can create lasting results. This is why many men experience temporary effects that fade quickly, leaving frustration rather than confidence. The foundation was never addressed. From a physiological standpoint, strength and size are expressions of how efficiently blood vessels expand, how well tissues accept and retain blood, and how balanced the internal environment is. When blood vessels are flexible and responsive, circulation becomes smooth and powerful. When they are stiff, inflamed, or chemically stressed, performance becomes inconsistent. Over time, this inconsistency affects self-image and confidence. Men begin to doubt their bodies, even though the issue is not a loss of capability, but a loss of balance within the system that supports that capability. Internal balance plays a critical role because the body is designed to prioritize survival over performance. In an acidic or inflamed state, the nervous system shifts toward protection. Blood vessels tighten, energy is conserved, and non-essential functions receive less support. In this state, chasing external results becomes a losing battle. Bicarbonate's relevance lies in its ability to support a healthier internal environment, reducing unnecessary stress signals and allowing the body to move out of defense mode. When this happens, circulation improves not because it is forced, but because the body no longer feels the need to restrict it. Confidence is closely tied to consistency. When the body responds reliably, the mind relaxes. Improved blood health leads to more predictable performance, which reinforces trust in one's own body. This psychological effect is often underestimated, yet it plays a powerful role in male health. When anxiety decreases and confidence increases, the nervous system further supports blood flow and responsiveness. The body and mind begin to work together rather than against each other, creating a reinforcing cycle of improvement. Another important aspect is cellular efficiency. Healthy blood flow delivers oxygen that fuels cellular energy production. When cells produce energy efficiently, tissues become more resilient, recover faster, and maintain better tone. This affects not only physical performance but also posture, presence, and overall vitality. Men often notice that when internal health improves, they feel stronger and more grounded in everyday life, not just in intimate moments. This broader sense of strength contributes directly to confidence. What separates lasting results from short-term effects is alignment with natural physiology. When blood health, vessel flexibility, and metabolic balance are supported, the body expresses its full potential without being pushed beyond its limits. Size, strength, and confidence then become outcomes of internal health rather than goals chased through external pressure. The shift is subtle but profound as the body begins to respond in a way that feels natural, stable, and self-sustaining.